Pellet therapy has been around for decades. Testosterone therapy as well has been around for decades. Now what we have is a bioidentical form of testosterone, the sex hormone testosterone. It is derived from yams and is the exact molecule created by the testicle for optimal replacement. What we do with BioT is bring your levels back to the upper quartile of normal, exactly as they were when you were younger. Men begin to lose a percentage of their testosterone every year beginning in the early 30s. Most men in their 40s and 50s and beyond will have testosterone levels in the 200 to 300 range, which is at the very low end of the reference range. What we do is we bring those levels back up to the optimal range of over 800. And what do men notice from this? The real question should be, what do they not notice from this? When testosterone levels slowly drop over the course of decades, the result is fatigue, increase in belly fat, joint pains, muscle aches, muscle weakness, anxiety, depression, decreased libido, and erectile dysfunction. These are all things that creep up on people slowly over the course of years as the testosterone slowly fades away. When we replace the testosterone, we bring the levels up over 800 within about 2 to 3 weeks, and these symptoms, each and every one, begin to slowly resolve over time. The longer they remain on the therapy, the more complete resolution of symptoms that we get. How are pellets different from other therapies that are out there? If you use a cream that you rub on daily, you may get a spike from 200 or 300 up to 1,000, but then by tomorrow, it's all the way back down where we started. If you use an injection per se, when you give the injection the next day, you may be over 1,000 with your testosterone, but 4 days from now or 5 days from now, it's all the way back down where you started. So we have this roller coaster or yo-yo effect, where as the levels go up and get to a certain point, you begin to start feeling better. But then what happens? Just as you're starting to feel better, the levels drop back below into the 600 and 700 range where symptoms begin again. And so doing those types of therapies help some, but they don't allow you to reach the full resolution of symptoms that you can with hormone pellet therapy. And that is because once the pellets are placed, within a couple of weeks, your levels get into that optimal range, and they stay there for 4 to 6 months, never dipping down into the 600s or 700s again. It is a far superior therapy, and I'm convinced it's a far safer therapy because the prescription testosterone medications that are creams or injections are not bioidenticals. Those molecules have to be altered by your body in order to be recognized and used. The results of that are more side effects and more problems with the therapy. The procedure is very fast. It takes about 10 minutes to place the pellets in the hip. The pellets completely dissolve over time, and the levels, as they drop again, will be replenished when we do another procedure in 4 to 6 months. The average man can receive 5 months of therapy with one pelleting, and that ranges from about 4 to 6 months depending upon some differences in renal function and cardiac activity and the general activity of the person. So if there are more questions that you have about testosterone therapy and its safety and utility in men with subcutaneous pellets, I'll refer you to this book by Dr. Gary Donovitz, the founder of BioT. This book can be found on the BioT website. We offer it to all the patients who are beginning therapy or have questions about the therapy. So there's no doubt in my mind that we can change your life with bioidentical testosterone. So please give us a call. Let us help you as we've helped thousands of others.